Hello viewers, this is Dr. Sanjay Dhar, Orthopaedic surgeon from Apollo Hospital, Navi Mumbai. I have the pleasure of being with you today and I will be sharing my experiences regarding a very common condition which most of us would be going through at some stage in life. I will be talking about heel pain, which is a very common presentation to us as an orthopedic surgeon. Heel pain can affect anybody, anytime, particularly ladies who are standing whole day in their domestic work. So it is a sharp shooting pain, particularly seen early morning when they get out of the bed and you feel suddenly a severe pain in the heel and you are not able to take steps. So nothing to get worried about. It is a condition which is very commonly seen, and it is a treatable condition. Most commonly, this cause of this pain is what is called commonly as plantar fasciitis or heel spur. There can be many other reasons, but this is the most common reason we all see. And other reasons could be like because of running, you get heel pain. People who are regular runners, they can get heel pain. People who have some old fractures which have not united nicely, they can get heel pain. These are common things. So in this condition, we generally assess them very strictly. We try to rule out any cause like uric acid elevation in the blood, or we can take X-rays where we see if there is any bone spur formation in the heel, or if there is any fracture which has been there earlier now which is causing bone formation and pain in the heel. So once the diagnosis is made, then as I told you, the most common condition is called plantar fasciitis, which is a very nicely treatable condition. We see it almost every day, at least a couple of patients in our OPD. And we at Apollo Hospital have a good protocol to treat such patients by screening them, getting their X-ray done, getting their investigations done, and then giving treatment. Like as I told you, there can be other associated things like thyroid deficiency. If there is thyroid hormone deficiency, we have to detect it and then treat it, and the condition gets healed. We have to rule out any uric acid elevation, which we have to treat, that can be elevated. And then we can give drug treatment in the form of vitamin D, calcium, and then certain lubricating agents which improve the bone lubrication. They can be given, so as a part of medical treatment. The most important thing in this condition is what is called as rehabilitation. We give advice in the form of a good footwear. As this condition can also be very commonly seen with people who have flat foot. So in such cases, we give them how to wear a footwear, whether it should be a soft footwear, any supported arch supports. All these things can be done once we do a good assessment of their feet, and with the help of the occupational therapist or physiotherapist in our hospital. We have a good physiotherapy department which does the assessment in case it is needed. Then similarly we can give footwear and arch supports, and then how to do exercises in the form of foot rehabilitation. I can today, in this very brief video, I can tell you the common things you can do, very easy steps which you can do to take care of this heel pain. One is treat your vitamin D deficiency, calcium deficiency, see to it that it is treated well. And other thing is do certain steps like good footwear which has good arch support. If you have flat foot, do exercises like you can put a handkerchief on the floor and then try to lift it with your toes, and do this exercise regularly while you are watching TV or something. That will help. To get a tennis ball at home and then try to use it like a mouse in the hand. Instead of hand, you hold it with your foot and try to roll it on the floor with pressure maintained, and as if you are rotating a mouse, and give constant pressure on the heel. So that will help. It will massage your arch as well as the heel, so you will get pain relief with that. Second is try to do tiptoe walking. You just walk on your toes. That will give strengthening of the arch and that will improve your heel pain. And fourth is, even at home, these days all the houses have, all the households have marble floors or granite floors or very hard floors, like earlier we used to have carpets, or these days we don't use those carpets. So if you have these hard floor surfaces, then try to wear some footwear, soft footwear at home also. Don't walk barefoot on these surfaces, and always try to do these few arch exercises. Tiptoe, do a good heel foot massage. You can use it with your own hand, digital pressure on the point of pain, and then all along the arch you give a good massage. So that will help. These small steps will probably help in most of the cases, unless there are certain specific reasons, as I told you, thyroid deficiency, uric acid elevation, and or if there is some alignment problem in the foot which can be treated with the help of the physiotherapist. Otherwise, this can be treated with these small steps. So, if at all you need any more advice and care regarding heel pain, you can drop in at our Apollo Hospital OPD, and we will help you in getting this condition improved. Thank you very much, and see you again.